Hello, I'm Dr. Leslie Haller, a dentist specializing in addressing the oral component of airway problems. These days, we are moving toward looking for the root causes of disease rather than just treating symptoms. Sleep research is finding connections between poor sleep and more diseases than ever, not just high blood pressure, stroke, and heart attack, but also impotence, memory loss, depression, dementia, and even some cancers. There are many kinds of sleep problems. For simple obstructive sleep apnea, several maintenance solutions have been developed to keep the airway open. The gold standard is CPAP, which pushes air through the airway. Mandibular advancement devices prop the jaw forward to keep the airway open mechanically. Implanted devices either stimulate the tongue to move out of the way or stimulate the diaphragm to pull air in. Now there is another solution, dental appliance therapy to stimulate growth of a permanently larger airway. This is the only solution that offers a cure. The reason we are seeing more and more cases of sleep apnea, and not just in overweight men, is because of epigenetics, the effect of our westernized lifestyle on our growth and development. The following video does a good job of describing this phenomenon.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. Adulthood. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition, however, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. The myth of the overgrown upper jaw that needs to be held back has long since been replaced with science. Science has shown that young children can be buck-toothed naturally, and that the lower jaw catches up over time with a fully developed upper jaw. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits. Children.
So what can a dentist do to help?
I'm Dr. Tara Griffin. We are here today in my clinic in Panama City Beach. I've been practicing dentistry for over 11 years. Before I discovered the VIVOS appliance, I was suffering every day with chronic head and neck pain, TMJ pain. I was practicing dentistry and been practicing for 5 years, but I was already looking for an out. I knew that with this much pain, I could not continue to practice dentistry. I had chronic sinus and allergy problems, bronchitis. I was not sleeping throughout the night very well. I was waking up during the night. I had severe daytime fatigue where I would need to go home and actually take a nap in the afternoon, just at lunch, you know? And so I was looking for a solution to the problem, but I didn't know what the root cause was until I learned about the VIVOS appliance. As soon as I started treatment with the VIVOS appliance, within the first 2 nights, I was sleeping soundly throughout the night. My energy was better during the day. The pain that I was undergoing took a bit longer to get resolved, but within the first 3 to 4 weeks, my pain level was reduced by 2/3 or more. Within a month's period of time, I was breathing through my nose better. I wasn't having the same sinus symptoms that I was having before. And within 3 months of treatment, my asthma had improved so much, I had no more problems with the inhalers and the frequency I was having to use with all of my asthma inhalers. My overall health started to improve very quickly. I was my own first patient. However, as I continued to treat the next patient and the next patient going forward, I was curious to see if they were going to have the same outcome that I had, and they did. 9 out of 10 had the very similar outcome that I had. So they were sleeping better in just a few nights, actually getting their energy back. They were less irritable. The pain that they had was going away very quickly. The teeth were beginning to straighten and align over time. So even though with this type of problem, it can take some time to get the long-term results, the immediate symptoms start to improve very quickly. Comparing my before and after picture with the VIVOS appliance, my smile was not symmetrical. My teeth were crowded. The gumminess of my smile was a major problem that I didn't like. I had unevenness in my eyes, also in my nose. My face was more round and less balanced, and that all helped to correct itself as well as I went through the treatment. When the VIVOS appliance is worn in the early evening and while you sleep at night, it allows the jaw to relax. It allows the airway to open up. It allows you to breathe through your nose and to get the oxygen that you need to the rest of your body for your body to begin to heal. By breathing through our nose, we are actually getting much more oxygen to our brain as well as our lungs, and we're producing nitric oxide, which is a vasodilator to allow the blood flow and everything to circulate better. And so a big component with this is it forces you to actually breathe through your nose to get the oxygen where it needs to go into the body. So that's a very important part of this. If you're interested in learning more about the VIVOS appliance, if this would be good for you, then I recommend you coming into a VIVOS center to be evaluated to determine if this is something that could help you.
After 15 months of painless, non-surgical dental appliance therapy, Dr. Griffin's airway increased from 7.7 to 24.1 cubic centimeters. Dental Solutions of South Florida can help support you with treatment for your CPAP patients. We offer painless, non-surgical alternatives for that percentage of your patient base who, for whatever reason, cannot comply with CPAP. There are the palliative mandibular advancement devices, or there is appliance therapy to enlarge the airway over time. We hope you will include us in your team for help with your non-compliant CPAP patients. Thank you for listening to this presentation. What follows are photos from actual cases.